Good evening, Team Kentucky. This is Lieutenant Governor Jacqueline Coleman. We have lots of updates and information to provide with you that are related to both COVID and the inclement weather, so I'm going to get right to it. We have some exciting announcements today regarding accessibility to COVID-19 vaccine sites. Our administration is committed to providing equitable access to the vaccine, and we know that there are significant barriers in both rural and urban parts of the state. Some Kentuckians are experiencing issues like traveling for their vaccine or navigating a website to schedule the vaccine. So the Department of Public Health is supplying vaccinations to local health departments and other community vaccination sites to ensure increased access to the COVID-19 vaccine. We have established a Find a Vaccine hotline with live operators who can talk to callers through the vaccine eligibility survey, help them identify nearby vaccine sites, and even stay on the line while contacting a site to try to schedule an appointment. The hotline number is 855-598-2246. That's 855-598-2246. If you are deaf or hard of hearing, please call 855-326-4654. We also know that because of centuries of health inequity, there are unique concerns in the Black community with the vaccine. We also know that because the Kentucky Department of Health, through the Office of Equity, now offers presentations to groups and organizations in our Black communities to both understand and address these valid concerns. We are also providing outreach in specific communities by supporting pop-up mobile vaccine clinics, specifically for communities of color or areas where people lack transportation to drive to a larger site. We are working to remove barriers, and I'm excited to announce numerous initiatives across the state where the work to provide equitable access for the vaccine has come to fruition. First, I want to start with the Bluegrass Action Community Partnership. They announced today their transit service will immediately begin offering free transportation to 2 regional COVID-19 vaccination sites. Residents within its 11-county service territory are eligible to receive appointments for round-trip transportation from their home to either the Kentucky Horse Park vaccination site or Ephraim McDowell's Hospital. These include the following counties: Anderson, Boyle, Casey, Franklin, Garrett, Jessamine, Lincoln, Mercer, Scott, Washington, and Woodford counties. To reserve a ride to either vaccination site, residents should call the Bluegrass Community Action Partnership Transit at 800-456-6588. And please call at least 24 hours in advance of your vaccination appointment time. The Bluegrass Community Action Transit vehicles are wheelchair accessible, and face masks are required at all times. Next up, we have an exciting announcement from Norton Healthcare. Today, we are announcing a pop-up walk-in vaccine clinic partnership between our administration and Norton Healthcare. This pop-up clinic is for underserved individuals ages 70 or older in Louisville at St. Stephen's Baptist Church and Bates Memorial Baptist Church. Select outreach for these appointments is being conducted by Norton and are intended for underserved individuals who are experiencing transportation and/or technology challenges. Next, we have some news from the University of Kentucky. The University of Kentucky will begin offering 4 outreach clinics on successive Saturdays, targeting areas with underserved populations due to race, language, economic, or other barriers. Registration coordinators from the Office for Student Success, the UK Healthcare Diversity and Inclusion Council, and the College of Agriculture will provide materials to patients while they are in post-vaccine observation, focused on empowering the patients to promote the importance of getting a COVID-19 vaccine among their own networks. Immunizers and other clinical volunteers are students and faculty in the UK Colleges of Medicine and Pharmacy. UK is consulting with state and city partners to identify 4 community organizations, one for each outreach clinic beginning this month. Finally, there are several federally qualified healthcare centers or rural healthcare clinics who are providing local outreach designed to assist vulnerable populations with access to the vaccine. Mountain Comprehensive Health Corporation is serving Letcher, Owsley, and Perry counties. Primary care centers of East Kentucky are providing outreach to Perry and Leslie counties. Juniper Health is assisting in Breathitt, Lee, and Wolfe County, and the June Buchanan Clinic is serving Knott County. We are very thankful to partner with these organizations to provide as many Kentuckians as possible the opportunity to receive their shot of hope. Switching gears, I want to make a quick plug about the Kentucky Speed Test. I know Rocky was on here Tuesday and he provided the latest numbers to you, but I want to remind you our administration is committed to providing broadband internet connectivity to every Kentuckian, but we need your help to do this. We need everyone, no matter where you're from, to participate. The speed test is the first step to bringing internet connectivity to every Kentucky home. It takes 30 seconds and is completely anonymous. Please visit speedtest.ky.gov to take the test. That's speedtest.ky.gov. And finally, today, February is Financial Aid Month, and I want to provide an update on the latest numbers regarding FAFSA applications in Kentucky. FAFSA is short for a free application for federal student aid. It is required for students to be eligible for federal Pell Grants and for student loans. Kentucky has consistently been above the national average for FAFSA completion. Last year, Kentucky ranked 13th of all of the states in our completion percentage. However, for the class of 2021, we are down 19% compared to last year. The numbers are even lower for low-income students, schools with high minority populations, and in our most rural communities. As a teacher and school administrator, I cannot overstate the importance of completing these financial aid forms. The decrease in the FAFSA applications could lead to a decline in students seeking higher education next fall. Financial aid is not just for four-year colleges. If you are interested in a short-term program or two-year degree, there's financial aid available for you too. There is no downside to applying. It's free, it takes 30 minutes or less to complete, and you have an 85% chance to receive some form of financial aid. In order to apply, visit fafsa.ky.gov. If you aren't sure how to get started, contact the Kentucky Higher Education Assistance Authority outreach counselors at kheaa.com. There are millions of dollars available for Kentucky families, and we want to make sure that our students get every dollar possible as they begin their post-secondary education journey. So those are the good news items and some updates about our vaccination sites. So now I'm going to turn it over to Dr. Stack for Department of Public Health updates. Dr. Stack.
Everyone. I want to expand just a little bit on the information the Lieutenant Governor shared about health equity and vaccination. In addition to the activities she described, we also are partnering with King's Daughters Medical Center in the Ashland region, and they are going to do outreach with a number of African-American churches and community over the next couple of weeks. So we're very grateful to King's Daughters Medical Center for their partnership and their additional outreaches in their communities. On top of that, I'd just like to remind everybody or share that we have within the Kentucky Department for Public Health an Office of Health Equity. This is an existing office on an ongoing basis that does work to try to help individuals among racial and ethnic minorities and rural Appalachian populations and others with health disparities. Vivian Lastly Bibbs is the director of that office and does a lot of wonderful work with the team in the Department for Public Health. So thank you to Vivian and the team who work on these important projects with us, and there will be more to come. And now turning to my other topics. In the news, as you've seen probably, are the topics of double masking and the topics of quarantine after being vaccinated. So 5 quick slides here on double masking. So I've shown you on the left-hand side, I believe, of your screen, a document from the CDC on its website that goes in great detail about why masking is important and how you should properly use it. I'd encourage you all to Google that and take a look at this. But I'd like to also emphasize that consistently we have said a mask is not a substitute for social distancing, and that masks should still be worn in addition to staying at least 6 feet apart, especially when indoors around people with whom you don't live. On top of that, masks should completely cover the nose and mouth and fit snugly against the side of your face without gaps. The emphasis here with the not and capital and the and highlighted is the federal government's emphasis on their CDC website. James, if we do the next slide, please. This is what has made the news. This is from February 10. They released a research study where they were showing different combinations of masks and how they would protect you differentially. And in these laboratory experiments, they find that the biggest problem is not the mask itself, it's the gaps around the edges of the mask. And so if we could go to the next slide, I'll show you some pictures of masks. So this is straight from the article. If you look on the left-hand side of your screen, you'll see a mask with a gap. There's a circle there. When people wear masks incorrectly, they either don't cover their nose. That's a big no-no. Your nose should not be seen. And they also have big gaps at the edges, at the sides. So here's what they did with the masks. They had someone wear a double mask. And these are dummies where they had a gas, come out from the dummy's mouth. They put a double mask in the tightness of the extra mask and a larger mask over a smaller one underneath, helped to seal those edges in front of your ears and probably around other parts under your chin and over your nose. The double mask helped to make a better barrier so you didn't have leakage out here on the outside edges of the mask. Another way to do this is to take a high quality mask. We even recommend currently that if you use a single mask, use a multi-layer mask, one that has 3 layers of fabric. And they show you here how you can tie a knot at the edge of the elastic string to essentially have it tighter around your ears to pinch together that gap and close it off. So it's not necessarily one mask or 2 masks. It's, do you have a properly made mask that doesn't have gaps around the sides and across the top and the bottom? You can do that by having 2 masks to close those gaps and make it tighter, or having 1 mask. Bottom line though, you need to wear a mask whenever you're anywhere near other people who you don't live with, and you need to stay more than 6 feet away from each other, whether you have a mask or not. Next slide, please. This is the quarantine topic. So this is in the news that yesterday this was updated. The vaccines are incredibly effective about preventing death and preventing severe disease. So essentially taking a serious illness like COVID and making it more like a little less serious illness like influenza. And so the vaccines are incredibly effective for that. But we do not know for certainty yet if the vaccines prevent you from getting infected with mild disease or no symptoms and still potentially spreading the infection. So if we could go to my final slide, please. This is the key point from this article, okay? The next slide, please, James. This is the key point. At this time, vaccinated persons should continue to follow current guidance to protect themselves and others, including wearing a mask, staying at least 6 feet away from others, avoiding crowds, avoiding poorly ventilated spaces, covering coughs and sneezes, washing hands often, following CDC travel guidance, and following any applicable workplace or school guidance. If you'll notice, the CDC, this is a direct quote from this article, from their guidance on their website, updated yesterday, is saying, if you're vaccinated, that is wonderful, and thank you for doing that because it keeps you safe. It keeps you from getting harmed, but we still don't have enough people, anywhere near enough people, protected directly. And so we need to make sure until other people are all protected adequately, we don't take our eye off the ball and we don't let down our guard. What the news coverage is saying, however, is if you are vaccinated, and this is also in that article, but way, 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 way down near the bottom of the whole guidance, is once you're vaccinated, after 2 weeks after your final dose, for the next 11 weeks, up until 3 months, if you are exposed to someone who has COVID, it might be safe that you don't have to be quarantined. All right. So for 11 magical weeks, that's all they said, that little gap of time, you wouldn't have to go into quarantine. And my interpretation of this, my recommendation to the people in Kentucky, is that that really is best decided in consultation with your local health department. If you get exposed and you can consult with them about whether or not you should quarantine, they're in the best position to help you interpret the right way to use that information. So it's not a get out of jail pass. I think, unfortunately, that's how this has been portrayed. It's not a get out of jail pass. You still have to do all the public health measures in order to keep everyone else safe until we're through this journey. Thank you very much. And Governor, I think it's back to you now.
All right. Thank you to Dr. Stack. So one more piece of good news. Then we'll do the COVID report, and then we'll talk about our new vaccination sites. But this piece of good news is important, and it's going to help a lot of people who have struggled through this pandemic. Beginning on February 15th, Kentuckians in need of helping make ends meet on rent and utilities can apply for a new, very large fund being administered through the Kentucky Housing Corporation. The Healthy at Home Eviction Relief Fund follows earlier, similar efforts to help our people stay in their home while also providing relief to landlords and utilities. It's how we come out of this pandemic without carrying the debt that can hold us back so that we can sprint into our future. This is so important. With more Kentuckians rolling up their sleeves, receiving these safe and effective vaccines, we see a light at the end of the tunnel growing brighter every day. But it's going to take months until everybody gets through and gets their shot of hope, though Dr. Fauci did talk today about thinking there would be a lot more vaccine in March and into April, and I hope he's right, and we're going to be ready. But until then, we need to be patient and vigilant. We got to keep masking up, maintaining social distance, practicing good hygiene, and avoiding crowds. This fund is going to help make that possible. So last year, Team Kentucky helped 4,135 households avoid eviction with about a $15 million fund in assistance. Starting February 15th, tenants can apply for assistance with rent or utility bills dating all the way back to April 2020, and they can also apply for 3 months of future payments. Payments will be made directly to landlords or to utility providers. Kentucky received $297 million in federal coronavirus relief funds to help make this fund possible, to prevent evictions, and to make sure people don't have their utilities cut off. The program is being run in 3 jurisdictions, Jefferson and Fayette, which are running their own programs, and then in all the other counties, all 118 other counties. So to apply in those 118 counties, everywhere but Fayette and Jefferson that are running their own program, go to teamkyhherf.ky.gov. And that is the website where you can see everything that will be required. Again, that's teamkyhherf.ky.gov. To apply in Jefferson County, you go to COVID-19renthelp.org. And to apply in Jefferson County, you go to stopmyeviction.org. Tenants must meet certain requirements to get relief. All that is on the website and the applications. This is $297 million to help out our Kentucky families. And I, for one, want to use every one of those dollars to help each of you stay in your home, stay safe, stay warm right now, and to not come out of this pandemic with debt that we can pay off through this fund. All right, like just about every one of the days that we've had for the last week, we have declining cases. We still have stubbornly high deaths. So today we're reporting 1,880 cases. Those are the lowest new cases for at least 4 weeks. And we are currently running below in numbers of new cases what we had last week, which again was our 4th straight week, a record of decreasing cases. Hospitalizations, ICU, ventilators, they're all generally stable, if not down a little bit. And the current positivity rate is 7.08%. That is the lowest since November the 6th. That is good news. Unfortunately, we do have 36 new deaths to report today. They include a 91-year-old man in Barron, a 53 and a 63-year-old man in Callaway, a 77-year-old woman in Clay, a 78-year-old woman in Crittenden, an 89-year-old woman in Fayette, a 91-year-old man in Fleming, a 38, a 59, and a 73-year-old man, all men in Harlan County, 66-year-old man in Hart, 92-year-old woman, and a 66 and a 71-year-old man in Jefferson County, 55-year-old man in Laurel, 92 and 94-year-old women in Lawrence, 2 women in Letcher County, ages 69 and 62, 62-year-old woman in McCracken, Madison, 7 individuals, lost 3 females, ages 82, 86, and 91. Oh, and actually, I had my numbers wrong. 4 men, ages 66, 75, 76, and 96. We lost an 89-year-old woman in Marion, a 64-year-old man and a 69-year-old man in Marshall, 75-year-old woman in Meade, 84-year-old woman in Mercer, 85-year-old woman in Mercer, 84-year-old man in Nelson, an 88-year-old man in Nelson, and a 70-year-old woman in Perry. And this virus is so mean that I talked to you about Sonny Bass. It was one of the memoriams we did. We talked about how long he'd been married and what a great family. It's either yesterday or the day before, his wife passed from COVID as well. So this is vicious. It takes people that we know and love. Let's make sure we continue to do the right things to protect those around us. I don't want to have 35 deaths again in the course of this pandemic, and we can do something about that. What we do is wear those masks, engage in social distancing, and then prepare to vaccinate people as quickly as possible. Let's look quickly at long-term care numbers. 22 new residents, 19 new staff testing positive, 4 total deaths added, attributable to long-term care. Again, the rate of death in long-term care is starting to go way down, which suggests our vaccination efforts are working. Let's show the total number of people vaccinated. As of today, we believe that there are 497,256. Let's go to the second one. Individuals, unique individuals, that's well over 10% of our population that have now had at least their first dose of vaccine in the Commonwealth. Now you'll see that we have more doses to give out right now. That's because we get our doses in and we start providing them on Tuesday. So Tuesday, there will always be the largest gap between Kentuckians that have received the vaccine and the total doses we've had. But what that does is shrinks during the week and it gets to 0 or below 0 because we're using stock from previous weeks by the time we get to the end of Monday. Let's show the other one that you just did, Jim. This shows you that for every week since January the 5th, we have been able to vaccinate more people than we've gotten first doses from the federal government. That means that we are efficient. That means we are building and have built a system that can do more than we are currently getting each and every week. Want to make sure that I remind everybody that there are 4 and soon to be 5 programs operating in Kentucky. There is our state program that is through regional sites, hospitals, local health departments, and then some select pharmacies and stores that we'll talk about that we're adding today. There is our long-term care program, which is run through Walgreens and CVS. There's a direct federal program to veterans through the VA and to DOD employees. There's a federal pharmacy program that will start near the end of the week that includes 100 plus, and we'll talk about it in a minute, pharmacies that are out there. And then there's going to be another program coming online here soon to help underserved populations. So today we are announcing a total of 156 vaccine sites here in Kentucky. That is a big deal. It's going to move us forward. and build out what we need to ensure, especially as supply increases, whenever that's going to happen, that we are ready to get it out and get it out quickly all over the state. There's a lot of information here, and I want everyone to know they'll be able to find more information on our website, vaccine.ky.gov, very soon. Here are the locations we're adding, bringing us to this 156. First, we have 6 new regional sites, and they are Kroger, Franklin County, 669 Chamberlain Avenue. It's that location. Second, Deaconess Henderson in Henderson County. Third, Deaconess Union in Union County. Fourth, TJ Health in Columbia. Fifth, King's Daughter Medical Center is opening a Carter County clinic in Grayson. And sixth, the Lawrence County Health Department and King's Daughter Medical Center together are opening a clinic in Louisa. So those are 6 new regional sites that help us to continue to build out our map. There are also 10 new Kroger store locations that are going to be providing vaccines that you can sign up through the same regional site portal. They are in Maysville, 2 in Ashland, 1 in Paducah, 1 in Murray, 1 in Campbellsville, 1 in Carrollton, 1 in London, 1 in Brandenburg, and 1 in Elizabethtown. Then there are 15 Walmart stores that are going to be receiving vaccine that we can get out in the following communities: Corbin, Shepherdsville, Carrollton, Winchester, Mayfield, Paintsville, Paducah, Richmond, Berea, Tompkinsville, Central City, LaGrange, Crestwood, Shelbyville, and Campbellsville. I know that's a lot, but there's more. We're also announcing 125 federal pharmacy program sites at Walgreens and Good Neighbor pharmacies. This is a long list, and we'll post it on our vaccine.ky.gov website. Program breaks down to 78 Walgreens and 47 independent pharmacies. Program aims to reach vulnerable Kentuckians all over the state, and we'll show you the reach here in a second. Virtually every new site we open offers additional capacity to administer more vaccines than we currently have supply to give them. So remember, we have a pie, and it's gotten just a little bit bigger, 28% bigger under the Biden administration. We are cutting that pie into more and more and more pieces, which may mean you have to call a few more numbers, but we have to increase our number of providers out there for when we get that flood of vaccines we want so badly, so that we can use them all really quickly and protect each and every one of you. The good news is, as supplies increase, we're ready. We're already ready for a lot more than we're getting, but we got to be ready to handle a whole lot, and that's what we're building out. And I'm proud that at this point, and ever since January 5th, our infrastructure has exceeded our capacity, meaning that we are now ahead in the planning instead of behind. The logistics are complex, but we're continuously increasing both our capacity and our efficiency to meet the needs in every community. Now we have maps to illustrate how much our vaccine program is growing across the Commonwealth. Let's start with what we had on February the 1st. All right, so on February the 1st, we were already building out a pretty good map. These were hospitals and regional sites with, I think, the first Kroger that we had added. And then last week, let's show that. Have we moved to slide 2? Okay, we added additional regional sites. You can see that's right, Northern Kentucky. We added Bowling Green. We added Murray State, which is helping us out, and a number of others. Now let's look at the new regional sites, 6 of them that we've added today. And you see that, again, the map continues to fill in. Let's add the Kroger, Walmart, the federally qualified healthcare centers, and the rural health clinics that we've announced now. Let's add the local health departments. And now let's add the 125 Walgreens and Good Neighbor independent pharmacies. All right, as you can see, we are expanding at a phenomenal rate. We are very quickly covering the whole state to get to our desired outcome where you never have to drive more than one county to get vaccines. We know that there's more that we need to fill in. We will have more information even next week. But if you think about that first slide we showed you and the last one, that's really about 2 weeks of work and where it gets us now. So it will take a bit for us to get to everyone, everywhere, as quickly as we want to. But today's announcements are a significant number of sites all over Kentucky where we are excited to get the vaccine closer to you and hopefully faster into your arm. With that, I think I'm turning it over to Director Michael Dossett, who is with Emergency Management, to give us an update on the severe weather we've been having. And from him, we'll go to Amy Cubbage for a UI update. A lot of information today.
Thank you, Governor. So today we're ending the period of a dangerous ice and snowstorm here in the Commonwealth. This began on Tuesday, and while we didn't see any sunshine today, we did see some very positive actions and outcomes that were highlighted on social media that demonstrated the resiliency of Kentuckians. We saw neighbors helping neighbors and communities pulling together to clear trees and debris from some of our impacted areas. Emergency management is built on these type of partnerships, and we also saw the relationships highlighted between our county and local emergency management personnel and our state agencies, particularly the great job that we saw from our Kentucky Transportation Cabinet, our Kentucky State Police, and everybody involved in that one. So I'd like to talk a little bit about the weather pattern, beginning with the early hours of 3 a.m. And if you could pull that slide up, James. Thank you. So our resident meteorologist, Joe Sullivan, put together a little bit of a time lapse. So this is what we were looking at 3 a.m. today. You see the area of accumulation was located along our borders and across central Kentucky, with a significant pattern over at our northeast. And that's at 3 a.m. Next slide, please. At 9 a.m., you see that the pattern of ice accumulation broadened, and you're looking at areas in the dark color of 0.4 of an inch up to 0.7 of an inch. We actually have some reported areas that received 1 inch of snow accumulation up in the northern part of the state. And you can see as it spread across the state, and then the lighter color was additional precipitation in the form of freezing rain and ice to 0.2 and 0.3 of an inch. And currently at 3 p.m. today, you see the results of the full pattern of the ice storm moved basically west to east across the state. We have an additional possible accumulation of 1/10 of an inch, and that'll move off into the west very late tonight. We're looking at some frigid temperatures coming on Friday and Saturday, and a possibility of some snow on Monday and Tuesday, but that will be the bulk of the heaviest impact that we've sustained. We're certainly appreciative of all of our citizens and the communities that came through this. So we'll talk a little bit about the power. If you can pull that slide up. We actually had a high of about 73,000 customers that were out of power through the entire event. And currently we have about 56,000 impacted, so that you can see from our briefing at 10 a.m. through 3 p.m. there's been a significant increase with the power companies working to restore those. James, if you can pull up the last power slide there. we still have counties that are impacted up to 10%, including Carter, Lawrence, Elliott, Boyd, Lewis, Greenup, and Bath. Powell, Montgomery, Bourbon, Fleming, most of these counties are what you saw reflected on the ICE map. Back to you, Governor. Thank you.
Thank you so much, Director Dawsett. Now we're going to go to General Counsel Amy Cubbage for an update on unemployment insurance. Amy?
Thank you, Lieutenant Governor. First, I want to talk about paper checks. For those of you who may have received a paper check but never filed a claim, we believe that is very few of you, but if you were in that boat, please mail that check to the Office of Unemployment Insurance, attention BPC. I think we may have a slide on this, I'm not sure. But that again was Office of Unemployment Insurance, attention BPC, 500 Merrow Street, 4th floor, Frankfort, Kentucky, 40601. And this will be on the Kentucky Career Center website. When you mail that, please include your contact name or your name, contact information with a phone number and email and a message explaining that you never filed for unemployment insurance. Please do not include a social security number. With that, along with a check, could open you up to identity theft issues, and we want to protect you from that as much as we possibly can. Now, if you are a claimant who is accurately receiving paper checks and formerly got debit cards, please don't forget that money has to be spent off of that debit card by February 28th. If it's not spent, it will go back to the Office of Unemployment Insurance. They will issue you a paper check, but that will take some time. So you will lose the benefit of the use of that money if you don't go ahead and spend that off. Talking again a little bit about 1099-Gs. We're coming up on the day, this Friday, in fact, is when you can start filing your taxes with the IRS. So if you have received your 1099, please look at it, make sure it's correct. If you have questions, check the FAQs on the website. And if you still think it's incorrect, you can email KYOU1099@ky.gov for assistance. Again, check those FAQs. Hopefully those will answer your questions. And don't forget to, if your problems don't get worked out before you need to file, the IRS has put a statement out about what to do. That is linked on the KCC website. And again, that was to report what you accurately received, not what the incorrect 1099 says. Next, I want to talk a little bit about fraud. I know we are still getting a lot of questions about fraudulent filings. Again, we've given the email address, but I'll repeat it again. If you have had a fraudulent filing in your name or in one of your employees' names, you can email uifraud@ky.gov. But please also know we've upgraded our fraud enhancement application called BARTS, Benefit Audit Reporting Tracking System, which does a number of cross-checks to make sure claims are both accurate and non-fraudulent. It will allow us to hopefully fish out more of those fraudulent claims. And then next week, we are hoping to launch another new computer application to assist people with their identity verification to help combat fraud, but also help you get your benefits more quickly. And next week, hopefully on the Thursday update, I'll give you some more information on that. Finally, I want to talk a little bit about our computer upgrades. We've been doing a lot behind the scenes to upgrade our capabilities in-house. And one part of that, as we have discussed before, is the new user interface that we'll be rolling out hopefully soon. A group of claimants has been recruited to test that before we go live so that we can understand how it impacts you who are claiming, not just those of us who work on the back end. Once we get that feedback and make any changes necessary, we're going to launch that for you. But please remember, this is not the entire upgrade. This is just one upgrade to the existing system. That system is old and difficult, as we've said, and this is not going to change everything overnight. Now, we have got the RFP out. We are working on that to try to figure out if we've got the money to upgrade that new system. This is only an interim measure, but we hope it will at least give you some better functionality. So that's it for today. Thanks.
All right. Thank you so much, Amy and Dr. Stack, for being here with us today. I am going to help take the questions. And for those of you on the line, we do have Amy Cubbage sticking around if there are questions about UI. And we also have Dr. Stack on the line for any health-related questions. So I'm going to start with my list here. Debbie Yetter from the Courier-Journal, you are first.
Hi, Lieutenant Governor. That looks like an ambitious expansion of sites around the state, especially some of the outreach efforts and pop-up clinics. But how will you all get the supply to those sites? I know some of the pharmacies are direct ship in the health centers, but otherwise, how are you going to be able to ensure there's enough supply to even make appointments for folks?
Well, so obviously supply has been the issue thus far. If we had as much as we actually needed or that we could actually dispense, we would be able to vaccinate a lot more people. But it's really important to us to make sure that everyone across Kentucky has access to the vaccine. And the last thing that we want is folks in their 70s, 80s, and onward having to drive multiple counties to get access to the vaccine. So these sites were really important to make sure that we open them across the state. And I'll let Dr. Stack speak to the method of distribution for the vaccines. Dr. Stack?
Thank you, Lieutenant Governor. So good question, Debbie. Remember, we've said supply, supply, supply. I said a couple or a few weeks ago, I thought we could do 250,000 vaccinations a week if we just had the supply. As the supply increases, we're adding additional locations. The federal government is also contributing through its direct arrangements with some of the pharmacies. So I hope what this shows, and believe me, I appreciate, because I hear a lot of the communications that come to me, the frustration about not being able to get access to the vaccine as quickly as we want. But I hope those maps show serious, thoughtful progression. And look, there are gaps on the map. We're filling those in as quickly and as methodically as we can. So please, I hope this instills some confidence and some hope. As far as the supplies, all of the shipments come directly from either McKesson, who is the distributor for the Moderna vaccine, or directly from Pfizer, who distributes its own vaccine, straight to the vaccination locations. In limited amount, some in their local communities may secondarily redistribute to another location. But all those pharmacies, all those regional sites, all the health departments, they get direct shipments straight from the distributor to them. If I could share two more things I overlooked. For the Walgreens sites, there's 78 of them. They still have available vaccine. Not all of their appointments have been filled. So I encourage anyone who wants to get vaccinated, go to the Walgreens site, search for the location nearest to you, and see if you have an available appointment you can make use of. We'll have more information in the weeks ahead with adding additional sites as quantities increase. And the last thing I wanted to mention, I overlooked, on some of our additional equity outreach, Walgreens has worked with us to use the excess vaccine it received from the long-term care facility program to help us reach some lower income housing settings, also some additional vulnerable persons who are not able to get out from their home or may be living in a non-nursing home, but still group home setting. And so we've done a number of other initiatives. It's just not always possible to catalog them all verbally at the press conferences. So we'll keep at it. Back to you, Lieutenant Governor.
Thank you so much, Dr. Stack. Next up, we have John Boyle from WFPL. John?
Hi, Lieutenant Governor. The administration has expressed the desire to address racial inequities, including some of the new initiatives you announced earlier. But we're nearly a year into the pandemic, and only about 4% of all vaccines have gone to Black Kentuckians, despite them making up about 8% of the population. So given that, I wanted to see what steps has the administration taken up to this point to try to prevent the disparities in vaccine distribution we're seeing now? And why haven't they been successful?
All right, I'm going to kick that back over to Dr. Stack.
Thank you, Lieutenant Governor, and thank you for the question. The governor and all of us on his team are committed to advancing health equity and working to have an equitable distribution of the vaccine. The governor went over this in a press conference. If it wasn't yesterday, it was the day before, that the very construct of the federal program skewed the way the distribution would occur. So healthcare workers are not evenly distributed across racial and ethnic populations. And teachers, K through 12 personnel, which were category 1B, skew younger and may also not fully represent racial and ethnic distribution across the state. So there were a number of ways that the program in its early phases trying to address those who are at risk because of their occupation or even because of their age, because the over 70 crowd does not skew evenly with the racial proportionality of the state. Those approaches to try to address the greatest mortality, to prevent the greatest number of people from dying because they're at highest risk because of their age, or also because of the federal program prioritizing healthcare workers, which is a global prioritization, by the way. The World Health Organization has made that a top priority along with those who are above a certain age. Those characteristics in the early phases sort of designed the way the system would unfold. As we now are solidly into 1B and not yet fully transitioned into 1C, just really beginning to put a toe in the water for 1C, I think you're already seeing in these early weeks that we're making a concerted effort. We're being thoughtful and intentional about trying to address and make sure that we have a fair and equitable distribution across as many different domains as possible, which includes your location in the state, includes your racial and ethnic identity, includes your age, includes your occupation. So we're working on all those domains, and I look forward to a lot more progress happening. But just to be clear, we would all agree that we need to do a better job and that there's a lot of work ahead to make sure that we distribute these vaccines so that everyone has a fair and equal access to them. Back to you, Lieutenant Governor.
And I'll add to that, Dr. Stack, you are right. The teaching profession in Kentucky most certainly skews white. There are not enough minority educators in our school systems, but we are working on that as well. Thank you so much for your intentionality, for your outreach and awareness around the vaccine availability. Next, we have Kristen Shanahan at WDRB. Kristen?
Hi, Lieutenant Governor. Thank you. So going back up to the pop-up locations, when will those launch exactly, and how exactly will people be notified about those, especially those who don't have access to the internet?
Okay, so I'll let Dr. Stack answer that question, and can you pull up the pop-up slide, please, so people can see? All right, Dr. Stack.
Thank you, Lieutenant Governor. For the pop-up sites that are occurring in Louisville with Norton, and there's some activities with University of Kentucky that are similar in Lexington, and then also with King's Daughters Medical Center up in Ashland. They are working directly with those church communities. And so the churches themselves are working with the hospitals in order to conduct the clinics and make outreach to their communities. So this is not like a regional site. This is not, there's a website, we're going to publish hours and you can all sign up. This is intentionally focused on helping these communities have confidence in the vaccines, feel assured in receiving the vaccines and having access to the vaccines in a very thoughtful way. The other slides that just got shown up here, these are our first outreaches to work with some of our wonderful federally qualified and or rural health clinics in the state. The federal government has also announced it will begin shipping directly to FQHCs and RHCs, and that program will begin in a very small manner next week, we hope, and then expand from there. So we will keep working at it, but these sites are not intentionally not for the general public to sign up at this point. These are for these entities to reach out to their vulnerable populations to ensure they have access to the vaccine. Lieutenant Governor.
Thank you, Dr. Stack. Next, we have Shelby Lofton with WKYT.
Thank you, Lieutenant Governor. With these weather updates, are vaccine sites still set to open tomorrow? And are there any plans in place for the sites next week, considering the weather we're expecting then?
So I'll let Dr. Stack speak to the vaccine locations with the impending weather. Dr. Stack.
My understanding is that the regional sites will be operational tomorrow, barring a new influx of weather, which I don't believe Director Dossett predicted was going to happen. They should be operational tomorrow, but just so everyone knows, my message to all of the vaccination sites has been safety first. The safety of the people we're trying to serve through vaccination and the safety of the people who are providing the service. So they will always use safety first, just like a flight crew does on an airplane. If we endanger the people providing or receiving the service, then the service itself has sort of been undone. So, but I do believe that the regional sites will be operational tomorrow, and that most of the local locations should be operational as well. But that's a site-specific determination based on the local safety conditions. Lieutenant Governor?
And let me add too that if you are in a place where you feel that you may not be able to reach the vaccination site because of weather and transportation, we would encourage you to reach out to that site as soon as possible so that you can get that appointment rescheduled. Stu Johnson, WEKU.
Yes, good afternoon. Thank you, Lieutenant Governor. The governor talked today earlier about the home relief, the eviction relief fund, and mentioned $297 million compared to $15 million in the state program. So how far will this go? Will this reduce the risk of eviction virtually all the way? Will this cover all in terms of housing?
So with those numbers, what I can tell you is one of the largest concerns that we've had with folks, of course, is things like mortgage and rent. I can tell you that with the Team Kentucky Fund, the vast majority of those dollars ended up going towards the housing and rent issues. Of course, groceries and utilities and things like that were also a component, but there's no question that's the largest part of that. And so utilizing the eviction relief fund, we are ready to make sure that we can apply all of these dollars to as many people that we can possibly help who needs it right now. And so I can tell you that there's quite a bit of money there, but we have so many Kentuckians who are in need of this. And so as far as we can stretch it to make sure that we serve as many Kentuckians as possible is exactly what we'll do. Karen Czar, also WEKU.
Good afternoon, Governor, and thank you. I just want a clarification and then a question about vaccines. When the governor said 156 vaccination sites, does that also include the pop-up sites like the one just on Saturdays or the weekends at UK? And then also, this is probably for Dr. Stack. When do we anticipate we'll be able to fully move into phase 1C, and how are these new sites going to help facilitate that process? Thank you so much.
All right, Dr. Stack.
So I don't know if I want to memorialize the pop-up site concept, but how about the intentional and focused efforts to make sure we address equity with a little bit more words, but those locations are not included in the 150 plus locations the governor announced. The ones we are announcing for the public are ones the public can schedule at, subject to the availability of vaccine. And as far as what was can someone help me, Lieutenant Governor, or the questioner? I don't remember the second question.
When will we be able to enter the 1C phase officially?
Oh, thank you. I'm sorry. So we are, because the state population is not evenly distributed, and because the vaccine is not evenly distributed, different parts of the state are moving at different rates. And so I think probably next week, some locations will begin dipping into 1C, while others are solidly in 1B, still working on reaching folks who are 70 and over. And so I think next week they'll begin a little bit of a transition. I have encouraged the test sites. We've encouraged them to start with the 60 and over population as they begin to transition into 1C, and I want to explain the rationale. If you were to have vaccinated all persons 60 and over in the state of Kentucky, that alone accounts for more than 91% of all the deaths that have occurred in Kentucky from COVID-19. Again, remember, many people want the vaccine to reduce their risk, and we are supportive and grateful for that, and we're working to get it to you as quickly as supply allows. The people who are in most immediate need are those who face the greatest risk of permanent medical harm or death from the illness, because death is irretrievable. And so we have encouraged people as they transition to 1C to work first on 60 and over, and then the entire 1C will be open. And I would imagine by the time we reach March 1st, we will solidly be in phase 1C, would be my estimation at this point. Lieutenant Governor?
Let me add that, the governor and Dr. Stack have been very intentional about serving our at-risk populations and the folks who we know need it the most. And that's exactly what he meant by starting with the long-term health facilities, by prioritizing K-12 teachers, and by making sure that we are entering 1C with age as a priority. And so all of these populations have been intentionally targeted to reduce the greatest risk. And so I think the governor uses the term surgical. It's being very surgical with these decisions. And it's also really important to mention that when it comes to entering phase 1C, that's going to happen at different times in different places based on population and supply and how many folks out of each group choose to take the vaccine versus defer until later or not at all. Melissa Patrick, Kentucky Health News. I bet this is going to be for Dr. Stack too.
Probably. Hello, Lieutenant Governor. So as the long-term care federal vaccine program wraps up and no first vaccines are to be given during their third clinics, what is Kentucky's plan to get the approximately 50% of staff that opted out of the vaccine vaccinated? And is there any discussion of offering a maintenance vaccine program like they announced today in Ohio?
Dr. Stack?
Thank you for the question. So the long-term care vaccination program, the federal program through Walgreens and CVS, has finished, as to my understanding, all of its first doses. If there are third visits that remain, and I think there are, those are to complete any necessary second doses. For those persons who are eligible as healthcare personnel, which would capture the staff in the nursing home settings, they are always eligible as a phase 1A person to schedule at any other location. And of course, we would like to encourage them and work to encourage them that the vaccines are safe and that they are beneficial for themselves and the people that they're responsible for caring for. And they'll have access through the community locations. Let me give one sense of a longer horizon for the public here. Pfizer has publicly announced that they have reduced by half the amount of time it takes to produce their vaccine. So hopefully Pfizer vaccine quantities will begin to increase in the near future. Moderna has continued to optimize its manufacturing and increase its output. And we have very high hopes that the Johnson & Johnson vaccine, which will be reviewed, I believe, on February 26th, and maybe the 27th, will hopefully be approved. And if it is approved, it's an exceptional pharmaceutical itself. It is 85% or better effective in preventing death and severe disease, which are the most important indicators. And it is also incredibly good in other characteristics because it's stable at refrigerator temperature. It's stable when the bottle is jostled or shaken, better than the mRNA vaccines. And it also is a single dose, which makes it appealing in so many ways. So we will have three fantastic pharmaceuticals in the Pfizer, Moderna, and Johnson & Johnson vaccine, subject to its approval. And as those things happen, the quantity overall is going to increase substantially. The ability to distribute the vaccine in a lot of different ways is going to expand a lot if we get the Johnson & Johnson vaccine. And then I think things are going to move even more quickly. And so folks who had the opportunity but declined in the beginning will be encouraged and given the opportunity later. But I don't know that there's going to be a specific program to go and capture those folks that already had their chance in 1A. We'll move on to relying on a much more robust infrastructure that will exist in the spring that doesn't exist now. Lieutenant Governor?
All right, thank you. Piper Hudspeth Blackburn from the Associated Press.
Thank you, Lieutenant Governor. My question has to do with those programs to provide access to marginalized or folks who may not have access. How long will these pop-up clinics be going for? I know that especially in communities with vaccine hesitancy, folks are more likely to get it if someone they know has gotten it, so they may want to come back and get it, so how long will those things be going for? And that also goes into like the FQHC program as well. Are these FQHCs seen as prolonged spaces where the vaccines will be given out for into 1C permanently? I just want more information in terms of how long these measures will last in order to serve those populations. Thank you.
Okay, so I'll send it over to Dr. Stack in just a second, but I started the press conference with lots of information about really targeted groups throughout rural Kentucky, specifically the transportation that Bluegrass Community Action is providing within the central Kentucky rural areas, and also the spots that are opening up in our more urban areas for communities of color. And so those are all very targeted. Those will go on as long as they need to. I know Bluegrass Community Action is excited to be providing this transportation and will do it as long as they're needed. In terms of the pop-up spots, I'm going to send that over to Dr. Stack and let him talk about the longevity of those.
I'm going to have to coin a new phrase so I can get the pop-up terminology out of this. These efforts are going to escalate. So let me use a different analogy here. In technology or in business product development, you talk about an adoption curve. In fact, that can happen in any kind of activity. You have the early adopters, you have the mainstream kind of middle part where most of us usually live, and then you have the late adopters. And so what we're going to have in the beginning is where we are right now. A lot of people are eager to get the vaccine. There's not enough quantity and the intensity of demand is very high. Then we're going to enter a phase, which will probably happen by late spring. So I'm thinking late end of April, May, and June, where now we have a kind of more of an equilibrium. We have enough vaccine and enough ways to give it and enough people who want it, and we kind of have a happy medium for a period of time. And then we're going to reach a phase where we have to continue to educate, reassure, address concerns to help those who have chosen not to get the vaccine earlier feel comfortable and confident in receiving the vaccine so they benefit from the safety and the protection of it, but also the people they love and that they're surrounded by benefit from that. And so we will have efforts that go on through most of this year, I would imagine. This is an activity that will extend easily into the fall as we reach more and more populations and reach people where they are comfortable. The goal here is to meet people where they are comfortable and at that happy medium to give people access to something that we hope they will want to accept because it's very beneficial. But ultimately, I'm a physician. I told people in the emergency department, I'm in the business of making recommendations and the patient was in the business of making decisions. My goal is to make it available to everyone a fair and equal chance at the same level of protection, to inform them of the risks and the benefits, and then to respect when they make their choice, whether to accept that intervention or not. So that's how I'm approaching the vaccine deployment, and we will keep working intentionally and with effort to try to reach more and more populations where they are comfortable and where they reside. Lieutenant Governor?
All right, and let me add to this. The governor would want me to say this, but regardless of when you get the vaccine, we still need to continue wearing our face masks, continue social distancing, and being as sanitary as possible with surfaces and hands, because this is going to continue for a little bit. And so this layer of safety is not does not make you completely free of all of the things we've been asking you to do for the last year. We've come this far, so let's keep it up until we can get everybody a vaccine. The last but not least, Tom Latek from Kentucky Today. Okay, so Tom Latek is no longer with us. So as I go ahead and wrap up today, I want to remind you of a couple of resources. Because of the weather, snowky.ky.gov will help inform you about weather and transportation issues. And then vaccine.ky.gov is a place where you can go to find out even more about the vaccine. Stay safe, stay warm, stay distanced, and make sure that you wear your facial coverings. And have a good evening, Team Kentucky.